Hello there. Let's have a chat about something you might have heard of called diabetes. Imagine your body is like a car, and food is its fuel. To use this fuel properly, your body needs a special key called insulin. Insulin is a hormone, which is a type of chemical messenger that helps the sugar from your food get into your body's cells to be used for energy. This sugar is called glucose, and it's super important for keeping you going throughout the day, powering everything from your brain to your muscles. Without this key, the sugar can't get where it needs to go, which can cause some problems. Now, in diabetes, there's a problem with this insulin key. Either your body doesn't make enough of it, or the key it does make doesn't work as well as it should. When this happens, the glucose can't get into your cells and instead builds up in your blood. This is what doctors mean when they talk about high blood sugar. Think of it like a traffic jam on a motorway. The sugar is stuck in your bloodstream, unable to reach its destination. Over time, having too much sugar in your blood can lead to health issues, which is why it's so important for us to understand and manage it properly from the very beginning. You might wonder how you would know if your blood sugar is high. Well, your body often gives you clues. You might feel much thirstier than usual, need to pop to the loo more often to wee, or feel really tired all the time. Some people even notice they're losing weight without trying to, or that cuts and grazes take longer than normal to heal. These are your body's ways of waving a little flag to say, hey, something isn't quite right here. It's always a good idea to listen to these signs and have a chat with a doctor if you notice them. So, in a nutshell, diabetes is a condition where your body has trouble controlling the amount of sugar in your blood. This happens because of an issue with the hormone insulin. It's a long-term condition, which means that while we don't have a cure just yet, we have lots of fantastic ways to manage it. By understanding what's going on inside your body, you can take brilliant steps to stay healthy and well. It's all about teamwork between you and your healthcare team to keep your body's engine running smoothly and efficiently for years to come. Diabetes isn't a one-size-fits-all condition. It comes in a few different forms. The most common ones we talk about are type 1, type 2, and a temporary type that can happen during pregnancy. Let's start with type 1 diabetes. This is what we call an autoimmune condition. That's a fancy way of saying your body's own defense system, which is meant to fight off germs, gets a bit confused and starts to attack and destroy the cells in your pancreas that make insulin. This means the body can't make any insulin at all. This type usually starts in childhood or as a young adult, and it's not caused by lifestyle choices. Next up is type 2 diabetes, which is much more common. In this case, your body either doesn't make enough insulin to meet its needs, or the insulin it does make doesn't work properly. We call this insulin resistance. It's like having a rusty key that struggles to open the lock on your cells. Type 2 diabetes often develops in adults over the age of 40, but we are seeing it more and more in younger people too. It's strongly linked to factors like being overweight, not being very active, and sometimes it can run in families. The good news is that making healthy lifestyle changes can make a huge difference. Then we have gestational diabetes. This is a type of diabetes that some women develop during pregnancy. The hormones from the placenta, which helps your baby grow, can sometimes block the action of the mother's insulin, leading to high blood sugar levels. It usually appears in the middle or later stages of pregnancy, and typically disappears after the baby is born. However, it's very important to manage it carefully during pregnancy for the health of both mom and baby. It also means the mother has a higher chance of developing type 2 diabetes later in life. So staying healthy is extra important. Finally, it's worth knowing that there are other much rarer types of diabetes too. These can be caused by specific genetic conditions, certain medications like steroids, or other illnesses that affect the pancreas. While they are not as common, it shows that diabetes is a complex condition with many different causes. No matter which type a person has, the main goal is always the same: to manage blood sugar levels and stay as healthy and happy as possible. Understanding the specific type helps doctors tailor the right treatment plan for each individual person. Managing diabetes is really important because if blood sugar levels stay too high for too long, it can lead to some health problems, which we call complications. Some of these can happen quite quickly, and we call them acute complications. One is hypoglycemia, or a hypo, which is when your blood sugar drops too low. This can happen if you take too much medication, miss a meal, or do more exercise than planned. It can make you feel shaky, dizzy, and confused. Another is diabetic ketoacidosis, or DKA, which is more common in type 1 diabetes. This is a serious condition where the body starts to use fat for fuel. producing harmful substances called ketones. On the other hand, there are long-term complications that can develop gradually over many years if blood sugar isn't well controlled. High blood sugar can damage the tiny blood vessels all over your body. This can affect your eyes, a condition called retinopathy, which can impact your vision. This is why regular eye checks are so crucial for people with diabetes. It can also affect your kidneys, which are your body's filters. This is known as nephropathy, and over time it can stop the kidneys from working properly, so regular checkups on kidney function are also a must. The nerves in your body can also be affected, especially those in your feet and hands. This is called neuropathy, and it can cause tingling, numbness, or pain. Because you might not be able to feel things properly, it's easy to get a small cut or blister on your foot and not notice it. If left untreated, these small injuries can become serious infections. This is why daily foot care is one of the most important jobs for someone with diabetes. Checking your feet every single day for any changes is a simple but powerful way to prevent serious problems from developing. Finally, diabetes can increase your risk of problems with your heart and larger blood vessels. Having high blood sugar over a long period can damage the walls of your arteries, making them more likely to get clogged up. This can lead to serious conditions like heart attacks and strokes. It sounds scary, I know, but please don't be disheartened. The brilliant news is that by keeping your blood sugar, blood pressure, and cholesterol levels under control, you can significantly reduce your risk of all these complications and live a long, healthy, and fulfilling life. The fantastic thing about managing diabetes is that you are in the driver's seat. The everyday choices you make have a massive impact on your health and well-being. One of the most important cornerstones of management is eating a healthy, balanced diet. This doesn't mean you have to give up all your favorite foods. It's more about balance and portion sizes. Eating regular meals and choosing foods that are lower in sugar, salt, and saturated fat is key, including plenty of fruit, vegetables, and whole grain foods, like brown rice and wholemeal bread, helps to keep your blood sugar levels more stable. Alongside healthy eating, regular physical activity is your superpower. Being active helps your body use insulin more effectively, which helps to lower your blood sugar levels. It's also brilliant for your heart, helps with managing your weight, and can give your mood a wonderful boost. You don't have to suddenly start running marathons. Simply aiming for about 30 minutes of moderate activity, like a brisk walk, most days of the week can make a huge difference. Finding an activity you genuinely enjoy, perhaps dancing, swimming, or gardening, makes it much easier to stick with. If you are carrying a bit of extra weight, especially around your middle, losing even a small amount can have a big effect on your diabetes control, particularly for type 2. Losing just 5% of your body weight can improve your blood sugar levels and reduce your need for medication. This can often be achieved through the combination of a healthier diet and increased physical activity. It's all about making small, sustainable changes that you can build on over time, rather than trying to do everything all at once. Every little step in the right direction is a victory. A vital part of your daily routine will be monitoring your blood sugar levels at home. This involves using a small machine to prick your finger and test a tiny drop of blood. This might sound a bit daunting at first, but you'll quickly get the hang of it. Checking your levels helps you and your diabetes team see how your body reacts to different foods, activities, and medications. It gives you the information you need to make smart decisions every day, helping you keep your blood sugar in a healthy range and stay on top of your game. Sometimes lifestyle changes on their own aren't quite enough to keep blood sugar levels in the target range, and that's perfectly okay. That's where modern medicine comes in to lend a helping hand. For everyone with type 1 diabetes, and for some people with type 2, taking insulin is essential. Since their body can't make it, they need to replace it. Insulin can't be taken as a pill because your tummy would digest it before it could work. Instead, it's usually given as an injection using a very fine needle and a pen-like device, or through a small pump worn on the body. For many people with type 2 diabetes, the first step in medication is often tablets. There are several different types of oral medications, and they work in different ways. One of the most common is called metformin. It works by reducing the amount of glucose your liver releases into your bloodstream, and also helps your body's cells respond better to the insulin you do make. Other tablets might work by helping your pancreas to produce more insulin, or by helping your body get rid of excess sugar through your wee. Your doctor will work out which one is best for you. It's really important to remember that these medications are part of a team effort. They work best when they are combined with a healthy diet and regular physical activity. Think of it like a three-legged stool. The medication, the diet, and the exercise are all needed to keep things stable and balanced. Your doctor or diabetes nurse will explain exactly how and when to take your medication. Following their advice is crucial for getting the best results and avoiding any unwanted side effects, so never be afraid to ask questions if you're unsure about something. Managing diabetes is a journey, and your healthcare team is there to support you every step of the way. Regular checkups are essential. These appointments are a chance to check your long-term blood sugar control with a test called HbA1c, as well as your blood pressure, cholesterol, feet, and eyes. It's your time to discuss how you're getting on, ask any questions, and adjust your treatment plan if needed. With the right support, knowledge, and tools, you can manage your diabetes brilliantly and live a full, active, and healthy life. You've got this.